The knee-chest position is used to examine the rectum and to perform a proctoscopic examination because it provides maximum exposure to the rectal area. This is a difficult position to maintain, therefore the patient should not be put into this position until just before the examination. Before beginning, perform the preliminary procedures described earlier. Pull out the footrest of the examining table and help the patient into a sitting position. Place a drape over the patient's thighs and legs. Ask the patient to move back on the table. As the patient is doing this, pull out the table extension while supporting the patient's lower legs. Assist the patient into the supine position. Next, position the patient in the prone position by asking the patient to turn onto her stomach by rolling toward you. This prevents the patient from accidentally rolling off the table. Provide assistance for this step by helping her to turn and adjusting the drape to provide modesty. Position the drape diagonally over the patient to provide warmth and maintain modesty. Ask the patient to bend her arms at the elbow and rest them alongside her head. Next, ask the patient to elevate her buttocks while keeping her back straight. The patient's head should be turned to one side, and the weight of the body should be supported by the chest. A pillow under the chest can give the patient additional support and help her relax. The knees and lower legs should be separated approximately 12 inches. Adjust the drape diagonally as needed, with one corner over the patient's back and the opposite corner over the buttocks and falling between the patient's legs. When the physician is ready to examine the patient, a small portion of the drape is folded back to expose the anal area. After the examination is finished, help the patient into a prone position and then into a supine position. Patients, especially elderly ones, are frequently dizzy after being in this position, so allow them to rest in the supine position before they sit up. Help the patient into a sitting position. Slide the table extension back into place while supporting the patient's lower legs. If this is the end of the examination, complete the final steps.